Rumi Kisyova, and I'm a plastic surgery doctor based in the United Kingdom. I work in Bristol, I've worked in London, and today with Karen from Essential Feeling, we want to discuss what is essential when we consider to have surgery, how to optimize the process before the procedure and after, what we should take, and how to make the whole journey as pleasant as possible. Karen, who is on the screen, has a studio in London and Frankfurt. She runs the business with her partner, and they specialize in post-surgical care, lymphatic drainage, mainly manual lymphatic drainage, which is so important when it comes to post-surgical healing and wellness and longevity in general. So I'll leave Karen to say a few more words about her and what they may do, and then we can start with the discussion.
Okay, so thank you. And hello, everyone. Yes, so we deal with patients when they've had surgery. We see very few patients before they come in for surgery. I think very often what we find is people go in for their consultations, they book the date, and then couple of days before it's like, oh, scurrying around, I need to read the notes, and then at that point discover that there is a lot of aftercare that needs to be done. But there's also some things that you can do beforehand as well, so we'll have a chat about that today. So where the bulk of our business is looking after people directly when they get out of surgery, a couple of days later, doing manual lymphatic drainage, and then as they go through the healing process, we adapt some of the techniques that we use to make sure that the body heals as fast as possible. So that could include any, some, or all of MLD, mechanical lymphatic drainage, where we've got different machines that we might use to speed the process up, that the body heals itself. If everything goes a little bit slow and there's some fibrosis, then we'll use different deep tissue manipulation techniques to work through that, some myofascial release, and then working with scars after surgery as well, some red light therapy. So it just depends on the patient and what's involved in their program, because everybody's different. And that's what we love about our job. There is no 2 days that are the same. So it's meet a patient, they'll be different to from one day to the next, and then just working out what exactly is going to help them on that day.
You made a very important note when you started that a lot of people book an appointment for their surgery, and literally a few days before that, they start planning what needs to be done. And because I deal with patients who have elective surgery and emergency surgery as well, I think in the emergency setting, that's normal. In the elective setting, it's slightly different, especially when it comes to aesthetics. And this is what we're discussing today. We're discussing people who have liposuction or tummy tuck or facelift. This is my impression that for a lot of those patients, this surgery may be the start of a new chapter in their life.
Absolutely.
And many of them wait for weeks and months. Some of them save money for a period of time. There is a lot of excitement. But also I think it's important to remember that if you want for this new chapter of your life, let's go this way, to continue for as long as possible, you need to prepare in advance for it. And I think good way to describe it is a lot of women who want to get pregnant, they start taking antenatal pregnancy pills just to make sure that their body is in optimal state. And I think it's very important to treat your body in the same way if you're going for elective surgery that's mainly driven by the desire to look better. So I mentioned earlier what to do beforehand, and I think it's...
Sorry, my dog's just come in.
Oh, okay.
Come on. Go sit down. Sorry. I shut it down, but he's found his way up.
What was I saying? That it's important to treat the whole process as something that will allow us to live our life with more confidence. So if we approach this period of our lives, the few weeks, even months before surgery, the period after that, I think we can optimize the results. And when we first met, we were discussing how important it is to start having lymphatic drainage and massage, especially after liposuction, as soon as possible. But also, I think it's very important, the procedure, because you want your tissues to become softer, more prepared, more pliable. So when you have the procedure itself, the recovery is completely different when the tissues are prepared.
And also, as well, if you have lymphatic drainage before, when the surgeon puts the scalpel in, I mean, you'll know this yourself, there's less fluid under the skin. So the scar that you're left with is way less visible because it's a cleaner cut.
Yes, plus we know that people who have had surgery and trauma, they benefit a lot from different types of massages and lymphatic drainage, purely because you remove this post-operative inflammatory edema that's part of the healing process. Something else I wanted to mention, very often we don't supplement our bodies properly as well. And it's almost like, again, I think the liposuction is a very good example. You basically want cells to be removed, fat cells to be removed from your body. And a lot of people don't realize that those fat cells contain toxins that are being released when you have the liposuction, because it's a mechanical aspiration of fat tissue. So it's quite essential for us to take all the right supplements way in advance before a procedure, because you want your body to be in a very balanced state. You want your inflammation to be managed as well as possible. And recently, I absolutely love the fact that I started working with a company, and we do a lot of super personalized supplementation for people who not necessarily go through surgery, but they just want to look good and feel good. And I think this is the absolute basis when you're going to have something as invasive as surgical procedure. So including things like very strong antioxidants such as resveratrol or curcumin is very important. And I think it's important to take them regardless of what you're doing, just because we know that inflammation in our body is pro-aging. It affects our body by creating wrinkles or cellulitis or so many things that we want to tackle. And very often we think that, oh, I'll have surgery and this is going to fix everything straight away.
As well, you know, we see so many people, I would say 80% of the people that come through our doors, because we're seeing them straight after surgery, we get like the real life story, I guess, of it. And they walk in, they're like, I did not realize what I was getting into, because we've decided that we're going to have this surgery. And so in our mind, it's not that big a deal, because it's also the media as well plays a part in this. Yeah. You know, you're in and you're out, etc., etc. And you are in and you're out. And a lot of the things are even day surgeries or just a couple of hours. But that does not mean that the recovery and the state that it leaves your body in directly after is as simple as what we are either led to believe or believe ourselves, because it makes it easier to go in. So I think a conversation that I have over and over again with my patients is that you might have decided that you're going in for the surgery because it's something that you want to do, but your body didn't see this coming. And so the effect of the surgery, and I don't mean it's the same as being hit by a bus, but, you know, effectively your body didn't know it was coming, so it has to deal. So that's why your 24 hours after surgery is such a state of flux, because your body's got to deal with it and figure out what's going on and what's happened. And then from that point, we pick it up and the process speeds up. But yeah, for that first period, people are in total shock. And particularly, I think, as well, when you think about patients that go to Turkey rather than into London, because the consultation process there is often very different. And the aftercare is different as well. So they get out of their surgery and they get back on a plane way sooner than a lot of the UK surgeons would recommend. And they fly and they come into us and they're crawling in. It's not a very good advert for surgery.
Even though it's one of the, let's say, lighter procedures in the surgical world, it's still a rather invasive intervention that causes quite a significant shock to the body. And sometimes people may have something as small as a removal of a skin cancer and they react for a few days. I cannot even compare it when it comes to liposuction. And even though it's a conscious decision that you want to go through this process, you're right, a lot of people don't know what's next. And this is why I think the process of consenting a patient for a procedure should, and most of the times involves a very detailed conversation about what to expect later, or at least this is what I've seen while working with my colleagues. They're quite good at explaining what to expect. And I think sometimes the excitement is just so overpowering that a lot of the advice we give for the aftercare just passes straight.
Yeah, just get me in. And especially if it's a last minute appointment because of a cancellation as well, which happens a lot. Yeah.
I think that's absolutely important. It's part of the human psychology. When you have waited for something for a long period of time, you don't pay that much attention to the small script at the bottom of everything. When the patient should start with the lymphatic drainage after a procedure?
Well, I'm just listening to you and I'm learning something as well, because we would normally say if you can come in 3 days before your surgery, your ideal solution, okay, come in 3 days before your surgery, have a session then, come in the day after or the day before and have a session then. And then your body has time to clear everything out. You don't need anything else. You're in optimal condition for the surgeon to go in. But actually thinking about detoxing and maybe a week before. I don't know what you think to that. When do you suggest starting the supplements, etc.? Because it could probably all start in conjunction.
So for me, supplements should be started at least 6 weeks, if not even longer before that, because our body is already packed with toxins. It's not like foreign world where you're eating the purest of foods. The other thing is that in order for the body to heal in an optimal way, you need all the essential amino acids, vitamins, and most of us eat food that's lacking nutrients. We don't eat nutrient-dense food unless we go to specific places to buy it. So I think when a patient decides to go through an elective surgery, it's good to see what their nutrient status is as well. And I think this is really good knowledge for each one of us to have, especially when in a country where we don't have a lot of sunshine. It's important for us to know if we have good levels of vitamin D, what are our microelements like selenium, magnesium, if we need to supplement them. The effect on things like selenium on wound healing is absolutely fascinating. The same applies for vitamin C. So I think if you're already taking supplements, amazing. If you want to give your body a boost, book a couple of intravenous infusions. With the company I work with, Optimise Health, we never book them just because you want to have something. We have very careful assessment. We see what's the most suitable for our patient, and we don't ask them to go somewhere. We come to their place, so everything is very luxurious. Someone comes to your home, delivers what you need, and they go. But I think it's important to start at least 6 weeks in advance. And this gives the body almost like a new skincare routine. You need at least 5 weeks for the skin to adjust. The same applies for the body. You need time for everything to start getting used to having everything at an optimal state.
I guess with that in mind then, ideally, if we were to do a manual lymphatic drainage session or two before they start the supplements to clear away almost like clearing the dirt. So you're wiping the chalkboard clean for the new. That would be a good solution.
Yes, and I think lymphatic drainage when it comes to toxins is an absolute must. And I appreciate fully that not everybody can afford to have it, let's say, once or once every 6 weeks. But even if you have it once every 3 weeks and then do things at home, because nowadays there are so many things you can do at home, even like dry brushing. It costs nothing to buy one brush and just do it, and your body just feels in a different way. You have this specific glow, your skin gets some more blood flow, and it's a kind of a form of a lymphatic drainage. So I think it's quite important for us when we see a patient in clinic to also do this educational process where they learn how to use this when they need it, but they continue using it after the surgical period or after they've given birth or after they've reached their ideal weight.
I think the danger with dry brushing is when you're straight out of surgery. If you're doing it in the wrong direction and you've got, because a lot of surgeons will recommend dry brushing, I'm always like, just wait, give it a month or something. Get your lymphatic system working, because everything is in absolute flux. So get your lymphatic system towards the real drainage points. When you get that first piece of the swelling down, maybe 2 weeks actually, when you get that first piece, then you can start, because the wounds are generally starting to heal at that point as well. But I always caution people straight out of surgery, just be careful. You do not want to be flushing that fluid in the wrong direction.
And probably a lot of people who are watching us now may ask, how come you have a massage of any sort after surgery? Trust me, the quicker you start mobilizing and the quicker you have any manual procedure, the better you'll feel. Because in essence, when you have the abdominoplasty, be it liposuction, facelift, the process, the mechanical process of readjusting the tissues causes inflammation that leads to fibrotic tissue that causes get surgery. You can feel the firmness. The whole idea of having lymphatic drainage, manual lymphatic drainage, because there is nothing better than the manual touch, helps with the process of fibrosis, helps the tissue to settle in a much nicer, softer way. So you still have optimal result, but without this toughness of the tissues. Also, your body gets rid of all the extra fluids, and a lot of people don't realize that when you're doing liposuction, you have to inject quite a lot of fluid into the body in order to get the fat out. Yes. And there are different techniques of liposuction. Of course, a lot of people use very minimal amount of fluid. A lot of people use a lot of fluid, but quite often you can wake up and be quite puffed up and bulky, and you'll be like, oh, is this what? A lot of people don't expect this. So I think having a lymphatic manual drainage straight after surgery, which doesn't mean you wake up and you're straight on the table, but at least like 3-4 days after that, is absolutely brilliant, and it complements the results in an optimal way.
And people are often asking, oh, but does it hurt? Or even they don't book in. They just like, because we say the same, and they refuse to book in because they're like, no, it's going to hurt. And especially if they've been out to Turkey or somewhere, because they do it differently at that point there. And we see it online as well. Even nurses, they're like forcing the fluid out of the drainage holes. And we have patients as well that have come in from Turkey, and they've been told to tell us to open their wounds up again so that we can continue to force it. There's absolutely no need to do that. If you just do a light pumping in the direction and clear the nodes, the body deals with it itself amazingly well, and there's absolutely no benefit in inflaming tissue, reopening wounds, forcing fluid out, and it's actually relaxing rather than hurts. And I think when you think of a massage, especially after surgery, you're like, no, because you're imagining getting down to the muscle, but we don't need to work the muscle. We're working the lymphatic system that lies in the first layer or just under the first layer of the skin. So the skin's in well, you know this, but the skin's in different layers. And that's where the lymphatic system is literally just under the surface. So if we go any deeper, we crush the vessels that are taking the fluid out. So we can't go hard because it's not going to benefit anyone.
No, you do. It's a very gentle procedure. And the thing is that very often people are like, oh, I had surgery. Is it going to hurt? Yes, it's a cut, so it's going to hurt. But the thing is that once you have a massage, it's the same concept. Oh, is it going to hurt? Of course, you had surgery. But the thing is that the more you do it, the less it hurts. Like,
absolutely. Even at the end of the session, they start feeling better. But the actual massage, it doesn't hurt. Even after surgery, it doesn't hurt.
And the reality is that when you retain fluids, the chances of you pain are much higher, regardless if it comes to hand surgery, leg surgery, just it doesn't matter which body part you're going to pick. The moment there is swelling, the moment the body accumulates fluid, you feel more pain. So that's why we advise elevate, move, try to, as you said, just move towards the armpits or the groins where the main bulk of the lymphatic vessels are, so you can help with this excess fluid to get out of the way.
And walk if you can, and drink water. Yeah.
I think you underestimate water big time.
Oh, it's nothing.
Yes, and very often if people come to clinic and they're like, oh, I want to look like this and like that, and when you check how much water they drink, they may tell me 5 or 6 drinks packed with sugar, but no water, which is like chronic inflammation. It's the same with any kind of aesthetic body procedures. No matter if we're talking about EM neoscoped, if we're talking about massages, if we're talking about even things like if you go for a simple aromatherapy, it's still kind of a massage. It's very much lighter. But still, it's a type of procedure that if you drink water, this will help the body get flushed and everything is out of your system, and it's so much better. But yes, very often nowadays people think that you are hydrated if you drink things that actually can dehydrate you and cause a lot of inflammation instead of keeping your cells in an optimal state.
And a lot of people say, oh, but I drink tea, that's got water in it, or I drink caffeine or whatever, it's got water in it. And when I explain that how caffeine speeds up the process of the fluid, as in the water, going through your body, so it doesn't have time to collect the waste particles on the way, it simplifies the process and the sense in cutting down on the caffeine and introducing more actual pure water, because then it starts to make sense. And I think sometimes we're told, oh, drink more water, don't drink caffeine, don't drink alcohol. I mean, there's lots of reasons not to drink alcohol, especially in the healing process. That's a different story. But as soon as people understand it, they take it on board better.
Exactly. You mentioned alcohol, and I'll continue on. In most instances, alcohol, especially if it's not high quality alcohol, I know it may make no sense me telling high quality alcohol, but I think there is quality ladder when it comes to alcohol. A, causes dehydration, and B, a lot of inflammation in the body. So if you start drinking before, around, and straight after the surgery, you in essence increase your recovery period, because the whole inflammation in the body will be at much higher state. So this is why I think it's very important for us to be very conscious when we go for a procedure we've decided to submit our body to, because it's a big thing. It's not a small, not, oh, just like infection or just tummy tuck. It's a big procedure, and being prepared, almost like you get prepared for a lot of gym sessions or getting ready for the perfect beach body, it's just as important.
Also, just on that point of alcohol, actually, so of course the inflammation, the dehydration, but we see a lot with alcohol and with smoking. When people start to do that again, wounds will open up again. So something that looks like it's closed begins to open up, and that's, I'm not telling you, but that's because the alcohol is in your blood, and really what you're doing is sending a poison to a point where your body's rushing to heal. And so you're flooding it with a poison and then it can't heal properly.
And
That's
it's the
how we
same with
describe it to people.
yeah. For instance, I don't do aesthetic procedures on people who smoke because I know that the potential risks are much higher. We do educate our patients a lot, especially in the hospital, when it comes to complications. And we know that if you smoke, the chances of having failed surgery are much higher, wound adhesions much higher, problems with healing much higher. So there are a lot of things here, because every time you smoke, your blood vessels go into a constricted state. So the blood just doesn't go to the areas that need to heal.
And it's the blood that carries the healing nutrients to the site that needs to be healed.
Exactly. And the reality is that a lot of us undergo surgery in a very suboptimal state of the body. So you can imagine that we're already in homeostasis that's not perfect, and you're cutting off all the nutrients that are essential. Because every time we cigarette, the blood flow is compromised for hours after. But how many smoke, let's say 2 cigarettes a day? Quite often it's a constant process, so your blood supply is compromised for almost throughout the whole day.
Wow. 2 cigarettes the whole day. That's massive.
Well,
most of the day. Yeah. That's massive. And then, of course, that's before you even start then with the stimulus of it all. And then you're not sleeping properly and the body heals when you sleep.
Yes, that's also very important. Reaching a very healthy sleep pattern when you want to recover. I think this is where supplementation is also very important. We know that magnesium is one of the must-take supplements because they relax the nervous system. And when your nervous system is at peace, you can actually sleep better, you recover better, and it's so important. And again, there are different forms of magnesium. I take mine every night. If I'm under stress or if I'm traveling, I take double the dose quite often, purely because I can my body when I feel that I'm struggling to sleep. It's so I think it's important for people to have those small additives in the whole period when they're ready to get a procedure done. And the same applies if you want to have any type of procedures just because you want to look good. It does. It comes to, let's say, radio frequency to the body, or you want to have, I mentioned EM scope new earlier. Again, you stimulate the cells. Those cells then will have to get clear of toxins. So the optimal way to do it is to take the supplements. I think sometimes intravenously it's much better than just oral, because there are so many oral supplements that don't do what they're supposed to do.
And then
yes, and then by all means incorporate manual procedure to help with the clearance of any toxins. It doesn't have to be on a monthly basis. If you can do it, it's brilliant. But even if it's once every 2 months, again, it's something that the body will be grateful for a long period of time.
So if you're going to go in for an elective surgery, you start 6 weeks out. You have this is the ideal world, the absolute ideal scenario, and then people can mix and match within that. So you start 6 weeks out, you have a couple of MLD sessions, you start the supplements, the intravenous, you go in for your surgery. I'm going to do MLD 2-3 days after you come out of surgery. At what point do the supplements start to change, switch up, kick in differently?
When it comes to supplementation, when you find a regime that works for you, it's good to stick to something because your body knows best. And the reality is that none of us is getting younger. We're only getting older. So yes, the supplementation may change. At some point, you may start thinking about things like hormone replacement therapy that may change what your body needs. I think things like antioxidants is a must, especially in this highly stressed environment we live in. Vitamins such as vitamin C, absolute must, because this is one of the main components when it comes to collagen. So you need the collagen for wound healing and so on and so forth, and you need this vitamin C. And quite often we see people who have bleeding gums and wounds that don't heal, and very often lack of vitamin C is one of the main reasons for that. So I think when it comes to supplements, there is no end date. If you find something that works for you, continue taking it, especially if you have been through a surgical procedure aiming to change the way you look and you feel. You cannot expect that you do something for almost like people who do cleanse for a week.
Yeah.
1 week you're on water and nothing else, and you want to achieve the perfect body, and after that you go and you get absolutely smashed with all the bad foods and alcohol and everything, and your body starts reacting. I think if anybody makes the decision, regardless of gender, regardless of age, to have a surgical procedure that is aimed to change the way they look and they feel, use it as a starting point for a body that will be in much better state, for a health status that will be optimal, that will allow you to enjoy many more years in a much better way.
Okay. So basically, once you start, it's so good for you. It's what we should be doing anyway. But I guess, as we're saying, this is like the fresh start, the new you, which it often is. Like for most patients, this is it. And it becomes like the surgery becomes a catalyst for eating better, exercising more. People feel more comfortable actually going into a gym and not so out of place now because they look different. That kind of change in life, and that includes the supplements and everything else that goes with it, I guess. Keep going with it.
Yes, it's a common thing. And it's a good when it's a very conscious and multifactorial decision. It just makes all the difference in the world when you approach it from every corner.
That's good. Good to hear. Good to hear. So I guess we just need to quickly ask if anyone's got any questions.
Yes.
Because we've talked.
I can see a lot of people waving here, but I cannot see any questions. However, if anybody wants to ask anything at any point, feel free to just drop us a line and we'll come back to you.
Yeah, always happy. And if it's, I mean, I don't know if anyone checks out the Essential Feeling Instagram, but we're always putting questions and answers up there, because if someone asks us something, we just post it as a video. If one person's asked it, chances are, you know, other people are going to be asking the same questions, but just not directly. So yeah, we'll often try and do our best to explain to you directly, but then also do a video as well.
Amazing. Karen, thank you very much for this talk. It was really nice to discuss all those topics, and I'm looking forward to seeing you soon.
Yeah, you too. Thank you.